We are all in this together, held in the grips of a virus that can be deadly and so far cannot be stopped. Good evening, everyone, and we thank you for joining us tonight. I'm Colleen Marshall. From the War Room at the Ohio State House, Governor Mike DeWine and the Ohio Health Department Director, Dr. Amy Acton, have been pushing out information on the coronavirus, telling us about the importance of social distancing and, one by one, restricting the things we can do, the places we can go. Sporting events, restaurants, bars, businesses, all closed because of this global pandemic. Tonight, we're going to be joined by the governor, Mike DeWine, Dr. Acton, experts, and importantly by you, viewers from all over the state and from parts of West Virginia, joining us from our sister Nexstar stations, not to just take in the latest numbers, but to get answers to your questions. We are social distancing with our experts tonight, grateful they can spend the next hour with us, helping you understand this health crisis. Governor Mike DeWine and Dr. Amy Acton, the Ohio Health Director, Matt Habash, who heads the Mid-Ohio Food Bank, and Dr. Ian Gonsenhauser. He's the Chief Quality and Patient Safety Officer at the OSU Wexner Medical Center. We're going to thank all of them for being with us, but we're going to begin right now with Matt Habash, because we've been talking all week about how children who rely on schools for their breakfast and their lunch are being helped with the closure of bars and restaurants, retailers, and as of today, hair salons, spas, and estheticians. More and more hourly employees are now going to be missing paychecks. So, Matt, we're going to ask you, are you anticipating more of our neighbors needing food assistance, and what are you doing to try to help them?
Yes, we definitely anticipated. Ever since Dr. Acton and the governor began to put out the idea of social distancing and the ramifications of what was going to happen, we went into a totally different mode. You got to remember, we've been doing a choice pantry, shopping pantry model for a long time, encouraging people to pick their own food. A lot of people in a gathering space, and we're like, well, this isn't going to work. So we immediately changed our process and to recognize first that we needed to practice social distancing, and we've been doing that very well. If you come to the food bank tonight, there's 60 cars outside instead of a group of people standing in a line, and we're serving them that way. We also recognize that we're already up about 20% in the amount of food that we're distributing, and our pantry here at the Mid-Ohio Food Bank is already up 52% from the same week a year ago.
A lot of people want to know, how can I help? Some of us are still working, but they're afraid, can we go and give provisions to you? Is it safe to hand them out, or are there going to be long lines there? What should we do if we want to help out?
Well, a couple of things I'm going to suggest. One is I'm taken very seriously. One of the things people always want to do, I call this managing America's generosity. People want to help. But what I don't want people doing is going out and starting food drives and collecting food. That will simply just drain the grocery stores faster, make it harder for people to get food. So we've set up a fund here. There are another of other funds. We immediately, when the governor began this process, and I really thank him for being so proactive, we started calling to order food even before we had the money, anticipating, in addition to 500,000 people we touch a year, we're going to be serving a lot more people, and this may go on for a very long time. Volunteering is okay right now. We are practicing social distancing. We clean this building every day. We're going to do mass cleanings on weekends.
Good to know.
So we are making sure that this space is clean. We've gone to, thanks to, yep. So as far as we're concerned, this is really, we're taking this very seriously, and the practices we're doing here, we're sharing with all of our 600 partners across the 20 counties.
Matt, we'll be checking back in with you later. Thank you so much. We're going to go now, though, to Governor Mike DeWine and the Health Director, Dr. Amy Acton. And we thank both of you for being with us. We know this has been a grueling few weeks for you. Governor, first up, several people wanted to know from Dayton, Columbus, and Youngstown, is Ohio going to go into a full lockdown like we are seeing in other parts of the country, where everyone is told to simply shelter in place?
I don't think we know that yet. What we're trying to do is, you can't really get ahead of this. But we know that taking action earlier is better than later. I've used the illustration from 102 years ago of St. Louis and Philadelphia. St. Louis got it right. Philadelphia did not, but they were only about 2 weeks separate in what they did. So in other words, St. Louis got it, but 2 weeks later, Philadelphia was doing it, and it made all the difference in the world. Philadelphia lost so many, many more people. So what we've been trying to do is focus on this social distancing. It's a term that I'm not sure I ever heard of before, but it's a term I'm using every day. But it really, Colleen, it really describes what we have to do, because people many times will say, you know, what order are you going to issue next? What are you going to do next? And what I've been saying is, government can do certain things, but really the people who are watching this, Ohio citizens, can do so much more. They can make decisions in their own life. They can be very, very careful. They can not go where there are crowds. You know, if you're elderly, stay in your house if you can. Try to get someone else to, you know, maybe bring the food to you and help you, because we know people 70, 80 years old, you know, they get more, it gets much more lethal for them. So it's what we can do ourselves, and that's really what our theme has been. Just be very, very careful. You know, don't go out unless you have to go out, and that's really true for everyone. So whether we have to get to the point where we're totally locked down, so to speak, I don't know that yet. But you know, Dr. Acton may have an opinion about that.
You know, Dr. Acton, we also have a question for you from Peggy in Cleveland, and she says, I live in Northeast Ohio. It seems to be the epicenter of this crisis in the state of Ohio, and she wants to know if it's because there's more testing being done there, or if they really have more cases in the northeastern part of the state.
Well, thank you so much, Peggy. I asked myself that very same question, and you know, right now, because of the lack of testing we had all along, we saw that the Cleveland Clinic and some of the areas got up more quickly. So I do think some of what we're seeing, even though we know we have a number of counties and areas of spread across the entire state of Ohio, we are seeing more activity in the Northeast Ohio region where I'm from, and we definitely have more testing in that area. So I'm thinking those two are probably related, but I think at this point it's safe to assume that we pretty much have spread throughout Ohio.
You know, Dr. Acton, we are hearing here at our station and sister stations around Ohio are getting a question about diagnosis. So a viewer from Mahoning County put it this way: if you are diagnosed with COVID-19, how soon can you return to work? And does that mean you then have immunity?
Well, that's a great question as well. And so most of us will go through this illness and be able to stay at home. In fact, studies so far show that about 80% of us, we might have a very bad flu. In fact, one that might feel a little bit more severe than one we've had before. But in guidance with our doctor, we'll stay at home. And most of us won't get tested. Even myself, you know, I might not need tested. If I have the symptoms and I talk to my primary care provider, they might just say, you know, stay at home. So what we're looking for as clinicians is that you go 72 hours without a fever, without any aspirin or Advil or anything that's artificially lowering your fever. And then we'll also make sure that you're at least 7 days post when you first showed signs of the illness. And that's the latest CDC guidance, and that's what our docs will be following.
We also got a question, doctor, if I can ask you this, but from an employer. Your recommendation now is that employers start taking the temperature of their employees from one of those distance forehead kind of temperature takers as they come into the building. So let's say the person tests at 98.9 or at 99. At what point does the employer have the responsibility to say to the employee, you need to go home now?
These are great questions. I would say temperature is a tricky thing. We all run a little bit differently. We all hear 98.6, but some of us run a little cooler, some of us a little warmer. And that really is, typically the temperature we are looking for is in that 100, 100.5 range that we would actually call a fever. But the thing is, as an employer, I would be asking that employee how they're feeling. And we're all going to be taking our temperature a lot, I think. It's not a perfect system. You know, some people might not show fever. We all know that you can be infectious when you're asymptomatic. But anyone who has feelings of being sick with anything that feels like the flu or a common cold, we all need to stay home the second we're not feeling well. So one thing we can all do is sort of check ourselves first thing when we get up in the morning.
All right, thank you. And Governor, earlier today, Mrs. DeWine, Fran had some great advice for things to do with your children when you're at home and you're trying to keep them occupied, because we're all going to be getting cabin fever. But we had a question from Pam in Grand Lake St. Mary's, who wanted to know, I'm a senior citizen. I've been told to stay away from my children, my grandchildren. So is it safe? And Governor, do you and your wife feel safe when you're spending time with your grandchildren?
Well, these are grandchildren that live very, very close to us. You know, they're in and out of the house all the time. The kids are no longer in school. You know, what Dr. Acton has told me, and she can tell all our viewers, but is, you know, you need to keep that number very, very small. And, you know, obviously you need to be very, very careful. You know, these are grandchildren that live right down the road. They're in and out of our house, you know, all the time. But I give the same advice, be very, very careful. You know, they don't go over now, for example, to Fran's mother. Fran's mom is in her 90s. She loves to see them come over, but they no longer go over there.
All right, thank you so much, and stay with us. How do you properly quarantine yourself or a loved one? When we come back, Dr. Gonsenhauser is going to show us how to do that.
Neglected. I wanted someone who not only was an expert in public health, but also someone who had a good bedside manner and could explain complicated issues to me and to the public. And I was very fortunate to get Dr. Acton. In addition to Dr. Acton, when this coronavirus was coming at us, we put together a group of 14 doctors from around the state of Ohio, and we've been on conference calls with them, and Dr. Acton has as well. Dr. Acton has also reached out to national experts, people who understand pandemics, people who have spent their whole lives studying this. And I've talked to them directly as well. So every decision that we've made, what I can tell Ohioans is every single decision that we have made has been informed by the best science that we can find.
And Dr. Acton, if I could ask you, I know you have been giving us these mini lessons on biology and medicine and pandemics, but if you could explain to people this particular virus, it has really no known treatment yet, and it's different from other viruses that we have seen like this, isn't it? For one thing, haven't you told us that it attaches in the lungs?
Yes, so coronavirus itself, it does come from a family of viruses that we've seen before. Interestingly, a part of that same group is the common cold. But this is a new virus. It was a zoonotic disease, which means it was transmitted from animals to humans, as we saw in Wuhan. And whenever we're not immune to something, that's always a human threat. And then it turns out, as we're learning in the science every day, it's twice as infectious as the flu and 20 times more deadly. It will be a while until we have a vaccine. Dr. Fauci of the NIH has said it'll be a year to a year and a half. And therefore, the kinds of measures we're seeing now are really our whole tool chest in terms of fighting this disease. But I can tell you, this is something that is very studied. Dealing with pandemics is something that, in my field, we're always planning for. But this is that once in a lifetime, more like the Spanish flu in that sense. pandemic and really something that we all have to take very seriously. I did hear you ask the question, you know, it is hard for people to get their heads around this. I can tell you, I've said in our press conferences, there are still days I drive to work where I am still knowing everything I know, 30 years of medicine in this field, still hard to get your head around because it's just not something we've experienced in this lifetime. And there are many consequences to this. There is, you know, the fact that it does leave our elderly and people with pre-existing health conditions at particularly high risk. But it's also, you know, we've talked a lot about the impact on our healthcare system and our infrastructure, and that's what you're seeing around the world, you know, in countries that are developed very much like us, really struggling to handle this pandemic.
And you know, both of you realize that this is financially a struggle for so many people. And Governor, one of the questions that we've received from a number of viewers, they say they're self-employed or they're part-time workers, and they want to know, with the modifications being made to the unemployment system, will they qualify? Can they get any help?
Well, we're working on that. We've already made the move in regard to someone whose company might not have sick leave. That person can go on unemployment right away once they go home. We've sped up that process. But we're looking as we go, Colleen, to how we can shore this up. I've talked to Senator Portman, Senator Brown. I've talked to members of our congressional delegation. They are working on this. This is a work in progress for all of us. Look, we understand, I understand what this has done to small business. My family was in a small business for many, many years. I understand, you know, the people who I deal with as I travel around the state. When I go into a restaurant, I know many of them now are unemployed. So, you know, it breaks our heart what they're going through. Our job is to make these decisions to save lives, because that's the only justification for doing what we've been doing, is because we want to save lives. It's the essential function of what we do, and we know that our actions will save many, many, many lives. So, but we still have to work very, very hard in regard to helping those individuals. I met with the Speaker of the House, the Senate President here in Columbus, and of course with our congressional delegation. So it is a work in progress. We get it, we understand, and we're going to do everything that we can.
You know, Governor, one question that we're getting, and I'm sure you are getting over and over again, this comes to us from Lynn. She says a vaccine would become widely available, we're told, in mid to late 2021. No one wants to stay home until then, and the economy can't survive until then if we're all locked in. So what are the short-term plans for reopening business, even maybe on a limited basis? Is that something that you're ready to even consider yet?
We're ready to consider anything as long as the medical advice, the science advice indicates that's safe for Ohio citizens. You know, as I listen to these questions, I really understand where people are coming from. They look outside and nothing in the world looks different. They go about their life and they hear some news that we're testing some people, but this is like nothing anyone has ever lived through who's alive today. There's no one who's watching this has ever seen anything like this. We may look like alarmists at this point, but later on the criticism that we will get, I'm sure, is we didn't move fast enough. This is a matter of life and death. We have all the indication that medical science would indicate that 40 to 70% of us in Ohio will get this if we don't take very dramatic actions. The other big problem that we're facing, and as I talk to our hospitals and I talk to our doctors, we have to slow this down. We have to keep our separation, because if we don't slow it down, we're going to be in the situation where Italy was and is, and where that spiked up like a rocket going up. If that happens in Ohio, as good as our medical system is, as good as our doctors and our hospitals are, we will not have the capacity to take care of people. We'll be in a situation where doctors are making life and death decisions about who gets treated and who does not get treated. who has this piece of medical equipment and who does not. That's not what we want in this country. That's not what we expect in this country. That would just be absolutely devastating. So we've got to slow this thing down. And every step that we have taken has been with that consideration. So while I understand people who say, when can we get back? We're going to let the science determine that. My goal is for people next St. Patrick's Day, we just had it yesterday and we didn't really get to celebrate. I hope next St. Patrick's Day that all of us are here and we'll have the opportunity to celebrate that. But we have to take these actions to save people's lives.
Dr. Acton, I guess that leads to the next question, which is, how will we know when we've peaked? What will the signs be for you that we've reached the top and we're on the downhill?
Well, I've been working with some of the best scientists in the world, learning from the people who actually created and developed the strategy that you're seeing employed all over the world now. And right now, there was a study out of the UK that just became public this week. And if everything we're doing is to slow down the spread of this virus so that we can, our hospital systems can handle a slower influx of sick patients. And they say that the peak, at least right now, with the current estimates, is somewhere around possibly late April, mid-May, maybe a little further out. We'll be getting more information on that daily. But if we did nothing, it would be that sharp spike. We saw Italy 3 weeks ago, go from 9 cases and then turn around to a situation where they were having to decide, and still are, who gets a ventilator and who doesn't. And those are awful decisions, and those same hospitals are needed for folks to deliver or to go if you have a heart attack or a stroke or a car accident. So we're fortunate in Ohio. We're blessed that we could take actions. I've talked to my colleagues in Washington. We've talked to the governor of other states, to see how they're faring, and they didn't have as much time to prepare. And their advice was, do everything you can every day. Counts, and everything each of us does makes a difference.
All right, Doctor and Governor, stand with us. We're going to be right back. We're going to take a break now, but we will be checking in with that doctor to find out what you do to safely quarantine at home. A lot of people want to know what happens if my spouse gets the disease. How do I keep my home safe? How do I make sure my children don't leave the house carrying that virus with them? We're going to be back with more from our experts. Thank you for staying with us all around the state of Ohio at our sister Next Star stations. We'll be back.
We will stick with you every step of the way and give you guidance. Do not be afraid if you cannot get a test. I want you to treat this like a very bad flu and use your common sense, and I want you to listen to our governor, and we will come to you every day and talk you through what is ahead, and we will do this together. Thank you.
Welcome back. 88 confirmed cases of coronavirus now in Ohio. The youngest and newest patient diagnosed is just 2 years old. It is not possible that your life is not affected by coronavirus. Everything from how we shop to where we can go and who we can be close to right now determined by this pandemic. And if you are just joining us, we are taking your questions to the people with the answers, including Governor Mike DeWine and Health Director Dr. Amy Acton, who are getting high marks for the way they are keeping Ohioans informed. Matt Habash with the Mid-Ohio Food Bank keeping a close eye on how this health crisis is hitting Ohioans in the purse and therefore the pantry. And Dr. Ian Gonsenhauser, Chief Quality and Patient Safety Officer at the OSU Wexner Medical Center, who we'll be talking to in just a moment. But Governor, we have had a number of people, state employees, in emails from around the state in places like Mansfield and Chillicothe in particular, concerned about non-essential employees being required to report to work, state employees, just because their jobs can't be performed at home. And they're worried about the spread of coronavirus, especially, they say, in correctional institutions. So at some point, will non-essential state employees be told to stay home? And if so, do they get unemployment benefits?
Well, we should be at the point today that all non-essential employees are home. And if we are not, then I'll take that responsibility to make sure that happens as the governor. We are following in the prisons, so the protocol is prescribed by the medical community. The first thing that we did very early on was we cut off any kind of visitors. And we only have essential people who are walking in those gates. So again, if the employee who wrote that is not essential, then that person should not be there in that prison. And so I'll talk with the director again tomorrow to check on that. But that's what our policy is. We don't want anybody there. This is what we're asking private enterprise to do. That's what we're asking businesses to do. If someone's not essential, they're not supposed to be there. If there's any way they can work from home, they need to work from home.
All right, and we are all concerned about catching the virus. Several people wanted to know, what do I do if someone in my house gets the coronavirus? Dr. Ian Gonsenhauser from OSU's Wexner Medical Center is joining us now. So, doctor, what should a quarantined house look like?
Yeah, thanks, Colleen. So Dr. Acton talked a little bit about who should be quarantining, and we're going to talk a little bit about how. The number one thing that you can do when you're quarantined is still the number one thing that we can all be doing, and that's maintaining very, very diligent and vigilant hand hygiene. We're going to talk that can be very helpful. They have to really maintain vigilance about cleaning those high-touch surfaces. Those are things like the light switches in the house, the remote, and other things that are touched a lot, door handles, etc. Any household cleaner will do. In addition to that, you really need to be cautious about sharing household items. So no sharing of utensils, doing your own dishes and taking care of cleaning up your space on your own if you're the quarantined person. In the meantime, the people around them, the people in the rest of the house, need to be doing a lot to support them so that they can do those things. One of the things to think about is laundry. Preferably doing your laundry often and doing your laundry on your own if you're the quarantined person can be very helpful. If you're not the person under quarantine and you're providing those services for them, being cautious, potentially wearing rubber gloves, definitely washing your hands and cleaning your hands regularly after handling any of those materials. And lastly, really important to be careful with pets. Many of us have pets at home. Those pets can run between one person to the next, maybe the kids as well. You want to be very cautious about that as well, because we don't know if the pets can potentially be a transfer source or vector between people in the house. So a lot of simple things you can do, but again, hand hygiene is really number 1, 2, and 3. Have to maintain very, very vigilant attention to your hand hygiene, preferably soap and water, but keeping hand sanitizer with you all the time is helpful as well.
You know, doctor, I imagine this is a good time to think about getting home delivery of food as well. If you're under a quarantine, if you've been told to stay at home, even if you don't have symptoms yet, it's a good idea to not even go out into the grocery store, right?
Absolutely. I recommend home delivery services for your food. You'll find that many of them right now actually offer a drop it at the door option that you can select that when you place your order. They'll leave the food at your door for you. You've already paid for it. The transaction has already happened, and there doesn't even need to be a face-to-face if you're home alone. The grocery store, it's a high traffic area. A lot of people are touching many things in the grocery store, many of those items. So again, hand hygiene when you're at the grocery store, when you're leaving the grocery store. Those Purell wipes by the grocery carts have never been more important.
All right, thank you so much, Doctor. We're going to go back to the governor now because we have a question from Melanie who wants to know, the Columbus Mayor, Andrew Ginther, issued a state of emergency in our city, and Governor, I know some other mayors are doing that too. Her question is that an indication that you're letting individual mayors make the individual decisions about restrictions for their own communities?
Well, mayors certainly have responsibility, and we talk to the mayors all the time. So we're sharing information. I talked to Mayor Ginther today around noon. So we have very good communication. These decisions are also made in 113 local health departments around the state of Ohio. What we try to do is to coordinate with them. Frankly, when there is a statewide policy, for example, all restaurants need to close, all bars need to close, I've had, as you've seen, no hesitancy to making these decisions to save people's lives. But there may be other things that the mayor of Dayton or mayor of Cincinnati or Columbus, or Youngstown, they may find some other things in their city that needs to be done. And so they also have people. They also have a health department, a city health department. And they have a responsibility as well. So it's a shared responsibility. We try to make the big decisions that affect everybody in the state. They are making the decisions that affect just the people within their city. But it's a great partnership, and we work very, very closely with them. We work very, very closely with all the 113 health departments in the state. These are people at the front line. They're doing an amazing job.
And Dr. Acton, a lot of people keep saying, well, when it warms up, flu season always gets better when it warms up. Are you expecting warmer temperatures to have any impact on coronavirus?
You know, we really don't have any evidence at this point that that is the case. And in fact, a lot of times this might be more, because it is of this coronavirus family, it might be a little bit more like a cold. You can still get colds in the summer. So we really don't have anything that lets us know that yet. I do think being outdoors helps all of us, and I would highly recommend that now. This is the time that you can get out gardening and go for a walk, take your dog for a walk, go for a hike. That allows for what I am now calling physical distancing instead of social distancing, because it really is about that physical space, and right. But we're going to be closer, and in some ways we need to reach out to each other more than ever.
We sure do, and we're going to reach out right now to Matt Habash. He's with the Mid-Ohio Food Collective, and I know you're working with food pantries and kitchens all throughout the state of Ohio. Tens of thousands of families are finding themselves without a paycheck beginning this week. It's a national crisis. So how are you partnering with other hunger relief organizations and other nonprofits when supplies are going to be depleted across the country?
Well, what we're doing initially, you got to remember, we've got an amazing group of, 13 food banks in Ohio. We talk regularly. This state has been a leader in helping us get food in the past, and we will need additional resources. I mean, we look at this as a marathon, not a sprint. Every day something's changing. We will see that throughout this. So we have food right now. We've got a couple weeks supply of food. We've ordered more food to come in. We've asked the governor for some additional help. There's supposedly some federal help coming. That'll take a month or two probably before it even shows up. So we're ordering food. One of the things that's unfortunately happened is as the grocery stores get depleted, we see less food. We have no bread. We used to always have bread because everybody's buying bread in the grocery store. There's nothing left on the shelves to supply a lot of our pantries that our retail partners have been very generous. So we've got to make up for those donations, and I want to make it really clear to everybody, if you're unemployed, you've just lost your job, we will help. Don't hesitate to come. I know you may have never been to a food pantry before.
Yeah, that's just what I was going to ask you, Matt. I know a lot of people have never had to access help like this before. They're suddenly finding themselves maybe with both paychecks in their house gone, and they're at home with their children who aren't able to go to school every day and get lunches. If I'm accessing the help for the very first time, what should I do? What do you tell people how to reach out and get the help that you're offering?
Well, the good news is, just here in Franklin County, we have over 100 food pantries. We've got thousands of them across the state of Ohio. Every community is connecting through a lot of other partners. We just stepped up we're going to help the shelter board because they're going to, as they deconcentrate the shelters, we're going to cook the meals so that those folks have meals there. That's going on all over the state of Ohio, where we will respond. Do not hesitate to reach out. In many cities, you can use the 211 lines. Here, it's hands-on. A lot of pantries are direct walk-in. You can just show up. Clearly here in Grove City, we do that every day. So we're encouraging people to reach. Do not wait. The other thing I would suggest to people, if you're shopping and you cannot find it in a grocery store, look in alternative places. Gas stations have milk and eggs and have a lot of supplies in their markets. Somebody said we're running out of baby formula. Well, the drugstores also have that as well. So think about alternative places to pick up cleaning supplies as well as food. That's what we're telling people that do have resources. But if you need help, don't wait. We want to make sure the kids, we've seen a big uptake in 3 days of the Columbus Public Schools accessing food. That's working. Marion County school system, which is a real leader in rural feeding, has gone to school buses dropping off, because they got the waiver, they're dropping off the food when the kid comes to the bus stop and getting it. That's a lot easier than getting to schools in rural communities. So all of these strategies, just remember, it will continue to evolve. We will be at this. We have a lot of experience in disasters, and if you think Katrina, it took years for that community to come back. If this economic crisis happens, we will continue to work with our amazing partners in government. State of Ohio, I can't thank them enough. They've been a leader.
Matt, it's also encouraging, isn't it, to know that some of the warm meal programs for senior citizens, at least for now, they've been continuing, right? Like Meals on Wheels?
Yes, I mean, we have to realize, we're clear here in Central Ohio, we've got a leader in Life Care Alliance in the way they've centralized their operation, and a lot of other communities are different. Those meals will continue. They've learned, they're practicing social distancing and how they're doing it. We've only had a couple situations where some senior centers have closed in Eastern Ohio, and we're going to need help getting out some senior boxes to those, because we're telling seniors to stay home, which is why we're going to need additional volunteers and additional help, because many of our pantries are run up by volunteers that are senior citizens. So we will make sure. The amazing thing is we have a database in Ohio that's tracking. We're lucky to have what we have in Ohio that we started here. We've given it to the other food banks in Ohio. We can connect with those senior citizens to make sure they're being taken care of. In the future, I'm assuming we're going to need a lot of help delivering food to different locations. That's going to be the new norm.
All right, thanks so much, Matt. And stay with us. We're going to be talking to Governor DeWine and Dr. Amy Acton and answering more of your questions about coronavirus. After the break, we'll be right back. Dr. Ian Gonsenhauser with OSU's Wexner Medical Center is coming back with us now. And doctor, there really might be more to this than we realize, right?
Yeah, absolutely, Colleen. So we're all learning how difficult it is to really do an adequate job keeping our hands clean and doing it all the time. Hand sanitizer is great, and we've got some of these great OSU hand sanitizer pens that I'm going to send to you back at the station, because we know how difficult it is to find right now. But to do a great job washing your hands, you have to pay attention to a few really simple steps. You need to wet your hands, obviously, in warm water, as we all know. About a dime to quarter size allotment of soap on your hands, and you need to really work it in there and lather it up well on all surfaces of the hands. Get in between the fingers, remove or move any jewelry that you may have on so you can get in and around that really well. Do that for about 15 to 20 seconds. Some of the tricks that people recommend are singing Happy Birthday or maybe the ABCs, any song that you know will last about that amount of time. Then get your hands under that water, rinse it well. You leave the water running while you use a clean towel or a clean paper towel to dry your hands, dry them well, and then use that paper towel to shut off the water and possibly even open the door to let yourself out. You really don't want to go touching the faucet or other fixtures after you've washed your hands. Keep in mind that after your hands are clean, you want to maintain that cleanliness by washing often or going back to that hand sanitizer if you have it around. It's simple, but it's easy to miss some of those few steps that can really be the difference between you being protected and you not being protected.
Wow, thank you so much. That is so much to think about just when we're watching our hands, but we all know now how important that is. And as we go back to the governor and Dr. Acton, I need to tell the two of you that since we started this program, we have received more than 200 additional questions from people all over the state of Ohio who want advice from you, who want you to help them out, so they are paying attention to what you are saying. One of the questions that we've received, Governor, that maybe you can help a lot of people with the BMV now closed, how are people supposed to get tags if they've got a new car or if they need to renew their tags? What is going to happen with renewing our licenses, or is all of that on hold?
Well, some of those things can be done online, and they can do that online. But I made it very, very clear that we're going to go to the state legislature, basically ask for a pause. An official pause and all that people will not have the obligation to do that until this crisis is over. The other thing that we're doing, I asked the Highway Patrol today, and I'm asking law enforcement throughout the state, you know, if someone's license has expired, you pull them over and you look at that and it's expired, they ought to they'll get a grace period. And, we'll have that officially in legislation next week, but, if they're right up against the border today, they should get a break on that. Because, look, we have to treat this like the crisis it is. If we were attacked by a foreign power, no one would think a thing about that. Everyone would assume, well, of course you couldn't go to the BMV. Of course you couldn't have done that. We have to act like that because this is very, very, very dangerous. There's no one who's watching this today, I don't believe, who was around in 1918, or at least who can remember being around in 1918. And that's when we had the last thing that occurred that was like this. And so the other thing, Colleen, let me just say, because we've had a lot of gloom and doom on this show, and Dr. Acton and I have been talking that, but we're going to get through this. We're going to make it. Ohioans are resilient. Ohioans are tough. Our goal is to get all of us through this. And, everyone out there who is watching that needs to be our goal. And the sun is going to come out, but it's going to get darker. We know it's going to get darker. There's going to be more of us get sick. But we're going to get through this, and this state is going to move forward. But each one of us to do that is not just what the governor does or Dr. Acton does. It's what you do in your own life, with your own family, and what you do and the decisions that you make every single day not only impact your life, your children, your families, but total strangers because of the way this stuff spreads. The best experts tell us that this spreads every 6 days. It doesn't spread every 6 days, I misspoke. But what it does is it multiplies in the sense. If you've got 100 people today who are infected, you would have 200 then. And then that 200 becomes the 400. And so you can see how it multiplies so very, very quickly. And we've got to slow it down. And that's how we save lives. And that's how we preserve our medical system. So that medical system will always be there for us. And whether we have a heart attack or whether we have a stroke or whether we get the coronavirus and we can't breathe, we want that system to be able to be there to take care of us.
Well, you are both getting praise and appreciation from all over the state. In fact, Dr. Acton, Camille and Hilliard says Dr. Acton is our very own Meredith Gray. You both have very large families. You have grown children. You know that Ohio families are worried. They are frightened about what is going to happen to them physically and financially. So before we let you go, tell us personally what you see for the future of Ohio as we try, as the governor said, to get through this and get back to normal.
Well, I have to tell you, I, first of all, couldn't be more honored than to serve for this governor. He puts our health and well-being at the top of his agenda. I've seen it every day, and to be by his side during this has been just an absolute honor. And I couldn't be more proud than to be from Ohio. I have 11.7 million patients, and that's how I see my job every single day. And I promise you, we will walk this with you. We made a commitment early on, the governor and I, that we would tell you everything we know as we know it. We will reach out to the best people in the world to find out everything in the science, and we will share that with you as we do every day at 2 p.m. We'll keep you updated at our website, coronavirus.ohio.gov. I think that's a great place because I know getting good information is so important. But we'll walk it with you. We will see the other side. And I honestly believe there are so many ways our life might end up being changed for the better when we go through something like this together. So do reach out, help those around you, help that elderly neighbor who, might not have family nearby. We'll do those things together in safe ways, but we'll walk it with you.
And Governor, just your personal feelings going through this. I know it's got to be exhausting for both of you, but as you say goodnight to the people of Ohio, what's your message about what's next for all of us?
Look, we are going to get through this from a personal point of view. Fran, I have 8 children, 24 grandchildren. We obviously worry very, very much about them. But I will tell you that the advice that I am giving and that Dr. Acton is giving is the same advice I'm giving to my own children and my own grandchildren. And so Our job is to get through it. My ultimate responsibility, my most important responsibility as your governor, is to do everything I can to preserve life, everything I can to get us through this particular tragedy. When I was sworn in as governor, I had no idea that we were going to be facing this. No one did. But we are facing it. We're going to face it together. As you can see, we have an absolutely amazing director of health. She advises me every day, but she's also advising the people of the state of Ohio. And what we have said all the way through is that we will be honest with you, we'll be upright with you, we'll tell you everything that we know, and that changes. That changes every single day. But the 2 o'clock press conferences that we have, we're going to continue to do those, and we're going to continue to answer the questions to try to keep people informed. We'll get through this. This is a great state. We're going to make it.
All right, thanks to both of you. That's Dr. Amy Acton, Governor Mike DeWine for being with us. Thanks also to Dr. Ian Gontenhauser and Matt Habash. And thanks to all of you who sent in questions tonight. We hope you found the answers helpful. As the governor keeps telling us, we are all in this together. Our sister Nexstar stations will have much more information for you on the days and weeks, possibly months ahead, and they will update you on air and online. Stay with us, stay healthy, and have a very good night.